Okay. All right, so welcome everybody. This is our first presentation in the series, Health Insurance Education. And this first session is Understanding Your Insurance. So this is a three-part series. Each month, we're going to focus on a different topic. This is the first one. So this one is a basic introduction to how insurance works and some different information that we're going to cover tonight. My name is Brittany Provost. I'm the manager of DSCC's Benefits Management and Research team. We work with our DSCC care coordination teams to help solve insurance problems. And I have two other benefits management team members with me tonight, Amy Edwards and Renee Woodson. So you will be hearing from them throughout the presentation tonight too. Captioning is available for the presentation. If you want to use captions, at the bottom of your screen, you should see the Show Captions button. It has a CC in the middle of it. If you click to turn that on, you'll be able to see the captions. ASL interpretation is also available. You'll see that we have ASL interpreters pinned, so you can see the ASL interpretation as it's going on. All attendees are muted, so throughout the whole presentation, you won't be able to talk unless we unmute you. So we have the raise hand button down at the bottom of your screen. So if you have a question where you need to talk, you can click that raise hand button. But our preference is that you use the Q&A button to ask a question. So not the chat button, which you might be more familiar with, but click that Q&A button and you'll be able to type questions in there. And Amy and Renee are going to help me monitor that throughout the presentation. We may stop to answer some questions while we're presenting, but we're going to try to save most questions for the end of the presentation to make sure that we can get through everything that we need to cover and then make sure we have enough time to answer questions. And again, that chat button has been turned off, so don't be alarmed. We know that you can't type in it. It's meant to be that way. We are recording the presentation, so the recording's already been started. The recording is going to be posted to the DSCC website sometime in the coming days or week after we are able to get the recording and upload it. We ask that during the presentation, if you're unmuted when you're asking a question, or if you're putting information in the chat or the Q&A, that we don't want you to share any personal information because it's recorded and others are listening in. We really want to make sure that your information stays private and that you're the only one that knows it. So please try to keep your questions general. If you have something that's really specific that you need help on, you can contact us afterwards. We're going to give out contact information for DSCC email, or if you're a DSCC participant or family, you can contact your DSCC care coordinator and ask them your question too, and they can get it to us. But we'll talk about that at the end if you need a more specific question. And then we're going to send you an email after the presentation. It's going to be an email that comes from Zoom, and it's going to have a link where you can get the slides, the related materials, and the recording once it gets posted. So that link will kind of be the one place that you can look for everything. Okay. So tonight we're going to go over a DSCC overview, just something brief. Many of you might already know what DSCC is, who we are, and what we do. But if you're someone that's not familiar with who we are and what we do, we just want to make sure everyone knows. We're going to talk about different ways to get health insurance, common types of health insurance plans. We're going to focus a little bit more on that conversation on private insurance. And then we're going to talk about how insurance works and a lot of other good, important information that you might need to know when you're working with your insurance. DSCC's vision is that children and youth with special healthcare needs and their families will be at the center of a seamless support system that improves the quality of their lives. Our mission is that we partner with Illinois families and communities to help children and youth with special healthcare needs connect to services and resources. We have 4 different programs that we provide care coordination through. The core program is ages birth to 21 with medically eligible conditions. Connect Care program is ages birth to 21 with special healthcare needs who are enrolled in a Medicaid Health Choice Illinois plan that has contracted with DSCC for care coordination. So that's a Medicaid managed care program. We also have our home care program. This is for children or youth that are in need of in-home shift nursing. And then finally, our interim relief program is for children and youth with eligible mental health or behavioral disorders. Okay, I'm going to turn it over to Amy Edwards to kind of dive into the insurance topics for tonight.
Hello, everyone. Thank you for joining us. We're going to talk about health insurance right now. And as you know, or may not know, there are a lot of different types of health insurance and different ways to get insurance. One way you can get insurance is through a public or government insurance plan. So these are programs that are like Medicaid, Medicaid managed care plans, and Medicare. You can also have private insurance, and we're going to spend a lot more time tonight talking about private insurance. And then there's also TRICARE, which is a health insurance plan for someone who is active in the United States military. And then we're also going to talk just briefly about other limited benefit plans out there. And these plans provide specific coverage for things like prescription, vision, or dental. A limited benefit plan is not like a complete medical coverage plan like you would need if you were going to go to the doctor or a hospital, but these plans can be combined with a private insurance plan. So for example, you may have a Blue Cross Blue Shield insurance plan, and then you have Delta Dental for your dental coverage. All right. We are going to talk briefly about how to get Medicaid. In April, we'll be talking more all about Medicaid. That's going to be the focus of our April webinar. So if you would like to learn more about Medicaid, we would love for you to register for that training. Medicaid is a health insurance program that is run by the state. Medicaid is for eligible low-income adults, children, pregnant individuals, elderly adults, and people with disabilities. It is important to know that you can apply for Medicaid at any time. Unlike private insurance plans, there is no specific open enrollment period. And if you are interested in seeing if you would be eligible for Medicaid, you can go and apply. And we're going to talk about how you apply or where you can go to apply. So like I said, you can apply for Medicaid in a few different ways. You can go online to abe.illinois.gov. You can call the customer helpline at 800-843-6154, or you can visit your local DHS Family Community Resource Center. You can use this DHS office locator to find an office near you. And this will be included in the slides that we send to you. And the nice thing about that is you can call that local office or click on that and find out their hours they're open and their location. All right, so we're going to switch gears for a few minutes and talk about Medicare. And Medicare can be really complicated. So we're just going to spend a little bit of time on it tonight. And it's important to know that Medicare is not Medicaid. A lot of times those get confused or mixed up because they sound very similar, but they're actually both very different programs. So Medicare is a federal program, and this means it is run by the United States government. Medicare isn't really a program you can apply for. You can become eligible for it when you qualify. And so to qualify for Medicare, you must be a US citizen or a legal permanent resident. And if you are a legal permanent resident, you may have some limits with your Medicare plan. We generally think about Medicare as being something for the elderly or people over the age of 65. And that is true. That is a large group of the Medicare population. However, there are also ways for someone under the age of 65 or for a child to qualify for Medicare. So a disabled young adult can qualify for Medicare if they have a certain disability. The disabilities that are eligible are set by the Social Security Administration. So a disabled young adult must get Social Security Disability Insurance, or SSDI, for 24 consecutive months before they can get Medicare coverage. And after that 24-month mark, the Medicare would automatically begin. Others at any age could get Medicare if they have end-stage renal disease, kidney disease, or ALS, which is also known as Lou Gehrig's disease. If you would like to know more about the disabilities that qualify, you can go to the Social Security website. We have put the link here for you, and you can look at this after you get the slides. You can also contact Medicare or the Social Security Administration if you have questions about the program or if you want to see if you or your child may qualify. All right, so we're going to talk about private insurance. And one way you can get private insurance is through a job or an employer. You can get private insurance if your job offers it to you, if it offers it to your spouse, or if you are on your parents' insurance. So a child can stay on their parents' insurance plan until the age of 26. And they can stay on this no matter if they get married or if they have other insurance available to them. Not all jobs offer private insurance, but many of them do. If you get insurance through a job, you may only have one plan option, or with some employers, you may have several plan options to choose from. Keep in mind that usually you can only sign up for insurance plans or make changes to your plan during open enrollment periods. And this is a specific time of the year when your employer allows you to make changes. It can be different with every employer. You can also make changes if you have a special life event like getting married or having a child or adopting a child. If you would like to learn more about that, you should reach out to your employer's human resources department or their insurance contact to find out when those time periods are or what is eligible for special enrollment periods. All right, so we're going to talk about another way that you can get private insurance, and that's through the federal marketplace. So this is a website where you can buy health insurance. It's like private insurance through a job, but you can only sign up for insurance during a set open enrollment period. It usually happens at the same time each year around November and December. Otherwise, the only other time you can enroll is if you have a special enrollment period assigned to you. And that's not something easy to come by. So it's really important to keep in mind that most likely this is something you would have to sign up for during that designated open enrollment time. It's important to know that if you are offered insurance another way, like through your job, you may not be eligible to get a plan through the federal marketplace. Having other insurance options will affect your eligibility for cost savings or discounts on marketplace premiums. So it could end up costing you more to get a plan on the marketplace if for some reason you declined or chose not to take health insurance through your job when it was offered to you. If you'd like to learn more about this, you can go to the Illinois website, getcovered.illinois.gov, or you can go to healthcare.gov and you can view marketplace insurance plans there. There are many plans to choose from each year. And just one more reminder that we are not in the special enrollment period right now. So you would have to have a good reason for them to assign you a special open enrollment period to be able to choose a plan at this time. All right, now that we've talked about ways that you can get insurance, let's talk about the different costs you will have with your insurance plans. So much of what we're going to talk about for the rest of this presentation can apply to any insurance, but we are going to specifically talk tonight about private insurance. If you have Medicaid, Medicare, or TRICARE, this information can still be helpful. So we encourage you to stay on because it's definitely something that you can apply to your plan. So a premium is the amount of money you pay for your health insurance every month. Usually if you get health insurance through a job, your employer will pay part of this amount, so it's less expensive for you. And then a deductible is the amount you pay for covered services before your insurance plan will start to pay. So you could have $1,000 deductible that you have to meet before your insurance company will start paying for anything under that plan. Deductible amounts vary, and you can have different deductibles for different services, like your medications or for out-of-network benefits. Coinsurance is a percentage amount you pay for covered healthcare service. So in our example here, durable medical equipment is covered at 80%. So that means that your insurance will pay 80% and you will pay 20%. So let's say that you have a piece of equipment that costs $100. Your insurance is going to pay $80 of that, and you will pay the remaining $20. This amount can change depending on what is being billed. So it's not always going to be a $20 amount. Sometimes, or most often, the amount is quite a bit higher. All right, so a copay is something that you probably know about. It's a set amount that you pay for a healthcare service. So this is similar to coinsurance, but a copay is set and it will not change by service. So if you have a $20 copay to go see your primary doctor in the office for a checkup, you're going to pay that $20 every time you go see that doctor. Sometimes with insurance plans, you'll pay more to see a specialist. So let's say you need to go see the cardiologist, you may pay a $30 copay to see them. Those amounts won't change from visit to visit. However, keep in mind that usually those amounts tend to increase each year when your insurance plan renews. So oftentimes you may have an increase of like 25, like it'll go from $20 to $25 for your copay. But for that calendar year, you would pay that same amount each time you were going to see your doctor. Your out-of-pocket maximum is the most you must pay for covered services in a plan year. It does not include the premium, but does include other costs like a deductible, coinsurance, and copay. Your out-of-pocket maximum could be something like $3,500 a year. We've seen some that go up to $10,000 a year. It just varies by plan. It's important to know that many of these amounts will reset based on your plan year, and your plan year is when your benefits start over for the year. Many people have a January through December plan year, and then some people have a July through June plan year. And these amounts can change each year as the benefits renew, like we just spoke about. All right, so we are going to talk about how insurance plans differ. There are many different types of insurance plans, and there's many ways that make them different. It can be very confusing. It's not something we expect you to remember because a lot of times we have to look up this information. But part of the way that they can be different is the cost that we just talked about. So some plans will have a lower or higher monthly premium. Some plans will have a high deductible, and some plans have no deductible. Some plans you'll have a copay, and some you'll have coinsurance. And then there are plans where you will have a copay and coinsurance. The size of the network of providers can be different depending on what plan you have. You may have a large network of in-network providers, or you may have a very small network of in-network providers. Some plans differ on what benefits they have and what they'll offer. Some plans don't have any out-of-network providers, so you are very limited on who you can see. And a lot of times you'll have just maybe a couple specialists to choose from, a handful of primary care doctors you could pick from. So this means that there are more limited plans for that, and then that depends on how much you're going to pay. So there are some plans that have more out-of-network benefits where you can see more doctors and your insurance will still pay, but those plans may cost more to have that benefit with them. Some plans have different requirements, such as getting a referral before you can go see a specialist. So let's say your child is having lots of ear infections and you keep going back to the pediatrician and you decide that they need to see an ear specialist, or maybe your pediatrician decides that. That's something where if your insurance plan required a referral, your pediatrician has to set that up for you. You cannot just pick an ear doctor to go to and make an appointment. It's very important to know how your insurance works because it will save you money in the long run, and you will get the most out of your insurance when you understand it better. If you have the option between multiple plans, it's important to to look at the different coverage options with each plan and decide which plan is best for you and your family. All right, so this is a plan comparison chart that we made, and we made this so it can kind of show you how different plans work and what the important parts of them are. So you can see across the top, there are different types of plans. There's HMO, PPO, OAP, EPO, and POS. Again, we do not expect you to remember all of this, but we hope that this chart will be helpful for you in understanding what we're going through right now. So we can see if a plan requires a primary care physician to manage your care. So for example, if you look at the HMO column, you are required to pick a primary care physician. So a lot of times when you go into that HMO plan, you will either get an email or a letter from the health insurance company telling you we need to know who your primary care doctor is. The reason for this is because they like to know that someone is monitoring the care that you are getting. You can also see if out-of-network coverage is common under a plan. So if you look at that HMO plan, you can see that they don't offer out-of-network coverage. So if you're someone who likes to travel, maybe you have a specialist a couple hours away that's not in network, that's going to be something you want to take into consideration, because most likely you're going to have to find a specialist that's closer and in network. Let's see. Plans that do require a primary care doctor usually require you to have a referral, like we were talking about. So your primary care doctor would have to make the referral for you to go see a different type of doctor or specialist. Let's see, I apologize, I'm losing my thought. So actual charges can vary based on the plan. You can see here, like an HMO, your costs out of pocket are going to be lower, but your coverage is going to be more limited. So if you look at like the PPO plan, you don't have to go through a primary care physician. You can go see whatever doctor you want. You can make an appointment with them, and you're going to have a larger out-of-network coverage, but you're also probably going to pay a lot more out of pocket. So you have to kind of weigh the pros and cons and find which plan is best for you. This is just a very simple chart that we made. So please know that this is just a little guide for you, that there's a lot more that goes into choosing a plan, but we kind of wanted you to get an idea of how each of these plans typically works. If you have questions about which plan to choose, you should talk to your employer benefits specialist or someone in the human resources department, and they would be able to help answer your questions. And then if you're getting your plan through the federal marketplace, there are also people that can help you figure out which plan would be a best fit for you and your family. Okay, so like we talked about a moment ago, the plan network is very important. Providers like a medical doctor, a durable medical equipment company, or a pharmacy are either in network with your insurance plan or they are out of network. So depending on what type of insurance you have, you may only have in-network benefits available to you, like we showed with the HMO plan. This means that you have to get all of your care at an in-network provider for your insurance to pay. If you were to go to an out-of-network provider, your insurance probably will not pay for any of it, and you would be responsible for the full amount. So an in-network provider is a provider who your insurance plan has made an agreement with to provide services to anyone with that insurance plan for a less expensive rate. Your health insurance plan wants you to use these providers because it saves them money and it will save you money in the long run. All right, so we are going to talk briefly about out-of-network. Like we showed you with PPO plans, some insurance plans do have out-of-network benefits, and then some do not have out-of-network benefits. An out-of-network provider does not have any sort of special agreement with your insurance company. And if you do not have out-of-network benefits, your insurance plan will not pay for these services because they do not have that agreement and there's not that discount in place. So you would have to pay more for your care or pay for the amount in full. If you do have out-of-network benefits, usually using an out-of-network provider is going to be a little bit more expensive for you. So it's always important to remember that if you stay in network, you're going to save more money in the long run.
Hello, I'm going to talk to you about your insurance card and understanding your insurance card. So if you have private insurance, you will get an insurance card. Now, your card may look different from someone else's card, but every insurance card will have the same kind of information on it. And you remember to always take your insurance card with you when you go to the doctor, or when you go to the pharmacy, or just whatever provider or whatever service you're going to get. If you're going to use your insurance, you need to have that insurance card with you. If you don't have it with you, it could cause a delay or a denial of your service. Your insurance plan should mail you a new card every year. So again, it's very important to make sure you don't forget and use your old card. Make sure you have the newest card with you. Okay, this is what's on your insurance card. This is just an example. Yours may look a little different, but of course, you're going to have the identification number, and everyone will have an identification number, or also called a member ID number, and everyone will have a different one. Also, the subscriber's name. So whoever subscribes to that insurance, if it's through your job or whatnot, then you'll have a group number. Your group number is the number that's given to your employer who bought the insurance plan. Everyone with insurance through that employer will have the same group number on their card. Next, you'll have the effective date. And this is the date that your insurance started under this plan. It should also give you some prices of some services. So say if you go to the doctor for an office visit, it should give you the office visit copay. It may give you your emergency room copay. So it depends on what service you're using. Okay, now we're going to talk a little bit about your member portal. This is very beneficial to have to know how to use your member portal. For a private insurance plan, you may have the member portal, and it may look a little bit different for different plans, but this is just the basic of what it may look like. Okay, your member portal is just like an online hub where you can find so much information about your insurance plan, and you don't have to make that call and stay online for a long time and stay on hold for a long time, rather, just for a couple questions. You can find it in your portal most of the time. So you can find old claims, you can view explanation of benefits, you can check to see if the service that you need requires a prior authorization. You can request a new card. If you can also find out about your deductible, how much it is, how much more you need to meet that deductible. You can see the cost of your service or office visit. You can review your plan benefits. And it also, in some cases, you can contact your insurance plan. They may have a chat agent. Sometimes they have live chat. You can ask the question. Okay, now also again, this is what you may see on your portal. Of course, you have your name here. You see here your claim and how much it was billed, and then you can see your responsibility. Let's see. Also, that shows you how much the total claim was, $150, and your responsibility was $30. So you can look up things of that nature. Also gives you your date of service, so you can see when you had that service. Yep. Okay, and also we have our provider locator. That's another great tool that your member portal offers. You can find a provider by calling the member services number on your card, or you can also use the health plan member portal or the health plan website. The search results will share if the doctor is in network or out of network. It is important that when finding a provider, again, you always use the in-network providers. All right, when you are going to find your provider, here's the search engine. So you can put in the type of provider. So here we're looking for primary care provider, and the specialty would be pediatrics. And then if you have other information, you can make it more specific if you like. And then just click the results and you will get the results. And here we found a Springfield Pediatrics Clinic. We found a provider there. And then another provider at Kids Clinic Healthcare. So this is what it will pretty much look like. This might look a little bit different, but basically this is what it'll look like. And you can also put in there like how close what proximity you want it to your home. If you want it within 20 miles, or if you want it within a doctor within 100 miles. So. And now we're going to talk a little bit about referral. As Miss Amy was talking about, some plans require a referral for you to see a different doctor or specialist. And so just if you don't get a referral, this could make you responsible for the full amount of your doctor's appointment or the services you've received. So even if your doctor tells you that your insurance approved the referral, it is always a good idea to call your health insurance plan and to check it. And a little bit about a prior authorization. When your insurance company reviews the services needed and gives approval before they will pay for your services, this is a prior authorization. Sometimes you'll need it for certain services, even certain DME equipment. You may need a prior authorization, also called a prior approval sometimes as well. You can use your member portal to check to see if you will need a prior authorization. You can call your insurance plan as well to check it. If your prior authorization is approved, your doctor will likely call you to let you know, or you will receive a letter in the mail. If your prior authorization is denied, you will get a letter from the insurance plan telling you why it was denied and what your rights are.
All right. Now that Amy and Renee have talked a lot about what insurance is, how you get it, all the insurance rules, all that information, we're going to talk just for a few minutes about what happens when you have more than one insurance policy. And it's important to know that you can have more than one insurance plan. Some examples, this is not all of them, but some common examples of when someone could have more than one plan are if both parents or guardians have insurance to their jobs. So if both parents have it and they want their child to be on both insurances, that child could have those two health plans. You could have private insurance and Medicaid. You could have private insurance and Medicare, and you could have Medicaid and Medicare. So just kind of know that it is possible to have more than one insurance plan if you have more than one option available to you. The important thing, if you do have more than one plan, is to know which one is your primary insurance and which one is your secondary insurance. And this is who's going to pay first and who's going to pay second. So primary means that your doctor will bill that insurance first, and secondary means that the plan will be billed after primary insurance. So it's really important to know, because when you go to the doctor, they may ask you, or your insurance may ask you to fill out a coordination of benefits form so that they know how the two insurances are going to interact. So which one's going to be first and which one's going to be second. You oftentimes have to call when you have two private insurance plans. You often have to call the private insurance companies to figure out which one's going to be primary or secondary. There's some rules that they use to kind of decide who's primary and secondary, so they can kind of talk you through which plan is going to be first and which is going to be second. So you'll know that when you're using your coverage. If you have private insurance and Medicaid, Medicaid will always pay after primary coverage. So if you have Medicaid and private insurance, or Medicaid and Medicare, Medicaid always wants to pay last. They want to be the payer of last resort. So they're always going to be the last one to pay, regardless of what insurance you have. Medicare can work a little differently. The Centers for Medicare and Medicaid Services, CMS, will decide if Medicare is the primary plan or if it's the secondary plan. Like if you have private insurance and Medicare, they have some other special rules that they use to decide that. So in that situation, you'll have to contact Medicare to find out. So this part can be a little bit of work when you have two plans, to make sure that you're using them both correctly. Another important thing to remember is that if you have two plans, you have to follow two sets of rules, essentially. So like Amy and Renee were talking about, with the networks for the doctors that you can see, getting a referral, getting a prior authorization, all of these plans might have different rules. So you may have one plan that says you don't need a referral and the other plan that says you do. And so you may have to play by both of those rules in order to maximize your benefits and make sure that you're going to have the best benefit, the most benefits available to you, and to make sure you're not having to pay as much out of pocket. Okay, so now we're going to talk about a couple of different documents that you might need to be familiar with when you're working with your insurance. So one of those we've kind of already briefly talked about was an explanation of benefits. We talked about with the member portal that you might be able to go in and see your explanation of benefits. This is a document that comes from your health insurance plan. So you'll either get it as a letter in the mail, or if you have email notifications enabled for your health plan, you might get it an email notification or be able to go onto your portal and see it there. But it's really important that you know that EOB is not a bill. It can look intimidating and look like a bill. There's lots of dollar amounts on it, and we're going to look at an example in a second. But it's just important to know that it's not a bill. It's a document that shows you the details on a recent office visit or services that you received, or like a procedure, something like that you had. And it's going to show you how much you may owe for that service. And you may actually get this document before you receive a bill from the provider. So it's just kind of a guide where it's the health insurance plan explaining to you what they paid, what you might be responsible for. So it's a good document to have and to know what you may be expected to pay before you get that bill. So this is the example. So this kind of goes through some different parts of it. But at the top, you'll usually have, information like the customer service number. You'll have the participant's name, patient name. So if that was you or your child, the date that services were received, the provider that services were received by, that kind of information all is at the top of the document. And then what is usually most intimidating, I think, about seeing an explanation of benefits, EOB, is this box at the bottom. There's lots of numbers, there's lots of words, a lot going on. It's kind of a lot to look at. And especially if there's lots of dates of service on an EOB, it can be very overwhelming to look at, because you might have a lot of different lines and trying to understand all the different charges that were paid and what you might owe. So it can be overwhelming. And I say just kind of take it line by line. So you have your dates of service, the service description, the claim status. So it's going to tell you whether or not it was paid, the provider charges, so what the provider charged, the allowed charges, the copay. So some services like this one didn't have a copay. You see it's $0, but this service on the bottom did have a copay of $35. And then it tells you what at the end here, probably your most important column, what you owe. This is your insurance company telling you what you should be responsible for this charge. So it's really important that you compare this document with any bills that you might get to make sure that they all match up. Because, for a lot of these things, the computer is very involved, but you have humans doing things too. So it can be easy for people to make mistakes. And you want to make sure that you're checking these documents, making sure everything matches, making sure everything makes sense so that you're not paying things that you shouldn't have to. And then the other thing I want to make sure you know about is the remark code. So this column right here that says remark code, if something was denied by your insurance, this column is really important to pay attention to because it's going to give you a little bit more of an explanation of why it's denied. So it may say something like prior authorization not received, referral not received, not medically necessary, those kinds of things. So it's important that if something gets denied, it's kind of a starting place to know what went wrong. So you have somewhere to go and kind of can work backwards to figure out how you might be able to get that service approved and have your insurance pay so that you don't have to pay. So that's an EOB. Now we're going to talk about a bill. So bill is what comes from the medical provider. And so if you went in this situation to Best Main Hospital and you had a surgery, they're going to send you a bill of what charges are your responsibility. So they'll usually tell you what insurance paid, what they charge. They may have the codes on here. They may not. It kind of depends on the bill. But usually they'll also have somewhere for you to call. So if you have questions, they'll have your information, the provider information. All that information will be on this document. So it does look very similar to an EOB, and they're very easy to mix up. But I always say, whenever you have questions, if you get this document and you're looking at it and you have no idea what it means, if it was unexpected, right? Sometimes when you go and have a surgery, you might say, okay, I know I have a $250 copay. I'm expecting that bill. And if it comes, it makes sense. You say, okay, yes, this was the date of service we had. This is the copay that I normally have. This makes sense. But if you got a bill and it's really high and you weren't expecting to have it, it's okay to call and ask questions. Call the provider, ask the billing line questions about what the charges mean, why they're your responsibility. That's what they're there for. They can answer those questions. And then you can also call your insurance plan, ask them the questions too. Because if you call the billing company, they may say, well, those are your responsibility because of your deductible or your coinsurance, your copay or whatever. And if that doesn't sound familiar to you or doesn't make sense to you, then you can call your insurance company and ask them information, ask them to explain your benefits so you have a better understanding of what charges you might be expected to pay and make sure that those charges are real. Because I don't want you guys paying, bills that you may not have to, because like I said, there's, ways that things get mixed up, there are errors. So always take a close look at these and make sure that they're what you expected. And if they're not, ask some questions and be curious about it. Okay, so just to summarize, if you get a bill, compare it to that explanation of benefits before paying it, and you have questions or concerns, call your insurance company or the medical provider to ask them about it. And if you don't agree with the bill, like if they denied services, your insurance company says, we're not going to pay for that because we decided it's not medically necessary, you have the right to appeal. You can ask them to reconsider that decision. So we're going to talk a little bit about appeals, but we're not going to get into too much of it tonight because we do have a training specific to appeals in May where we're going to go really in depth and give some examples and kind of work through all of it. But in case you can't attend that training in May, and just to give you some, more information during this training that we're doing, we're going to spend a few minutes talking about appeals tonight. So an appeal is when you ask your health insurance company to reconsider their decision. They're required to tell you why they did not cover services. So like in the example I just said, maybe they say, we're not going to cover this because we decided it's not medically necessary. That's them telling you why they didn't cover the services. But that doesn't mean that that's, the end of the conversation. If you think that it is medically necessary, your doctor thinks it's medically necessary, you can appeal and ask them to reconsider it. So you should get a letter from your insurance plan that says why they denied it and kind of explains a little bit more in detail about it. And then you have the right to file an appeal with your insurance company. So that's where you'd start that appeal process and tell them in a more formal way that you don't agree with their decision. It's really important that if that's the route that you want to go, that you exercise that right. There are 3 different types of appeals you can file, and these are based on the time, outcome, and medical need of the denied service or supply. And once we kind of talk through them, hopefully that part will make a little bit more sense. So there's a pre-service appeal, and these are before the service happens. So this kind of goes back to the idea of a pre-authorization, prior authorization. That's where it would kind of be denied before the service happens. So if your service that you're getting requires a pre-authorization, so let's say you have to get a procedure done and they say it requires a pre-authorization, and your doctor sends that in and your insurance comes back and says, we're not going to pay for that, it's not medically necessary, that's a pre-service appeal. So you're going to appeal the decision because you didn't get the service yet, but they gave a decision before you got the service. Post-service appeals are for services that were already received that were denied. So maybe you already went and had that surgery or procedure, and then you got a denial in the mail saying that they decided it wasn't medically necessary and they're not going to pay for it. That's when you'd start this appeal process for a post-service appeal. Generally, the appeal process is the same either way, but it's important to know where you're at in the process so you can, take the right action. Because if you know that something was denied before you get the service, if you can wait and see if your insurance will pay for it and get, that decision overturned and changed to an approval, you can save yourself a big headache and a lot of, payments if they're asking you to pay for the services. But afterwards, you can always work backwards and try to ask them to reconsider the decision too. And then expedited appeals is a different kind of category, but it's used when a regular appeal could seriously risk the life or long-term health of a person. So something that needs to be done really quickly. So if you need the health plan to decide this appeal, within 24 hours, 48 hours, that kind of thing, you need to do an expedited appeal. The packet that you send in is going to be a letter to your insurance plan. So you're going to be writing a letter to them saying that you disagree with their decision and why you disagree, and tell them what result you want. And the letter needs to be to the point and specific. You're going to want to include a letter from your doctor, medical provider, that explains why they support the decision to appeal the denial and why the services are needed. And then any other information you have that might be helpful. That could be calls with your insurance company where you were, told information from them, other medical reports, or reports from others that are involved in care that would support the need for the service. Once you have all that stuff together, you're going to want to mail that letter, that packet of information, certified if you can. And this will give you proof that you sent the letter before the deadline. Because one of the important things with appeals is that you want to make sure it's submitted by the deadline, because that right doesn't go on forever, infinity, end of time. You have a certain deadline where you have to submit everything by, and your insurance company will tell you that. It's usually in that denial letter too. So you want to make sure that you're paying attention to the deadlines and submitting things on time. And you want to make copies of that packet. So anything that you're sending to the insurance company, you want to make sure that you keep so that you have a copy of it so that you can look back at it and that you're not giving away all of the copies of everything that you had. And again, you can request that expedited review of your appeal if a treatment or procedure is needed right away. And if you get your insurance through your employer, you might be able to get help from the Human Resources or Benefits Department if there's some resources available to you through that. Okay, we have some resource links here for you that you can look back at when you have the slides. So we have a link to the Illinois Attorney General and the Department of Insurance. They both have dedicated departments that talk about health insurance and can help you if you have questions on your health insurance, or if you want to file a complaint with your health insurance. They both kind of have some avenues that you can take to explore that. We have the marketplace, which is what Amy was talking about. If you want to get private insurance and you don't have private insurance through your job, you can explore going through the marketplace. So that's that specific link. We have the senior health insurance program, which is, like it says, senior health insurance, but they also have a lot of people that can help with Medicare. So if you have questions on Medicare, you can go to them as well. And we put the Medicare website for you, just so you can go right to that website and look at the information that they have there. We have the Medicaid website if you have more questions on Medicaid. And then we have another resource from Patient Advocate Foundation. They have a resource library with lots of handouts and things on how to understand insurance and other variety of topics related to health insurance. So it's a really good resource to check out. And then I also put the DSCC resource library so that you can see all of the resources that we have in there about medical or health insurance related things. Okay, to summarize everything that we talked about tonight, I know it's a lot of information, but there are many ways to get health insurance, and we kind of went through all the different options. So hopefully you have a clear picture tonight on how you could get health insurance. Each plan can be different, and it's important to understand how they work. I think that's maybe the most important thing to take away from tonight, is that understanding how that specific plan that you have works is really, really helpful to making sure you get the most out of your insurance. Because if you have plans that change, like from one job to another, your plans will change. And so it's really important to understand how insurance works and how your specific plans work to get the most out of it. Using those in-network doctors can help you maximize your benefits and hopefully save you some money. And if you need help, there are many resources that will give you more information or guidance, and DSCC is one of them. So, feel free to reach out to your care coordinator too. If you're with DSCC and you have questions, they can definitely help. Okay, we've saved some time for questions, and I don't know if we have anything in the Q&A. We have about 10 more minutes. So Amy or Renee, is there anything in the Q&A that we need to answer?
No, there was just one question in the beginning, but it wasn't related to the training.
Okay. Are there any hands raised? Does anyone want to raise their hand and ask a question? You can use the raise hand button down at the bottom of your screen. And Amy and Renee will unmute you, and then it'll ask you to unmute. So you'll have to click the unmute button in order to be able to talk. It's kind of like a double unmute.
All right.
Hi.
Hello.
Thank you for the information. I have a question about my daughter have Blue Cross Blue Shield community, which is a Medicaid managed plan, and she is on like SSI for her disability. So she is disabled, but we're having a problem with them like approving her physical therapy sessions or like occupational therapy. And we've been doing this for the past since like they joined like 2020, I believe. So I know the therapists have appealed, the doctors have appealed, like we would get like 3-4 visits, and then we get 1 visit, and it like was like really like it's not helpful at all. So the therapists have even went through peer-to-peer appeals and stuff like this to get her some insurance coverage. Is there any assistance in since it's a Medicaid, and she was always had because she has disability since she was small, she always had therapy, and the Blue Cross Blue Shield keeps saying now no, she can be done at home, or her caregiver or somebody can do a home plan, but it's really not feasible because all the she's in a wheelchair, she needs the lifts to help with her standing and walking and exercises and stuff. So how can we get around like those appeals, or like with the Medicaid kind of Blue Cross?
Sure. I think I'm going to ask you, if you don't mind, to send us an email. At the very end, we're going to have the DSCC email address. And if you could send us an email with some more details, I'd like to go back to Blue Cross and figure out why they're denying the services. Maybe it is one of those things where they're not getting a specific piece of information from the doctor that they need, but it sounds like the doctor has been very involved. So I'm not sure what else they would need, but that will help us if you can give us, send us an email with some specific information like your name and your child's name. And that way we can take it back to Blue Cross and try to figure out what it is that they need to make sure that your child gets the care that they need.
So my daughter is not in the DSCC anymore because she is aged out at 21. Is there still resources helpful? Like, who do I send the email to? Or
yes.
It's not?
Send us the email at the end here. It's just dscc@uic.edu, and we'll have you sign an authorization form and make sure that we can communicate with Blue Cross and make sure you get connected with the right people. Absolutely.
Okay. Send it to that email, not to her previous advisor or counselor. Okay.
Yeah, just this email. I mean, if you have the previous care coordinator's email, you could try that, but just in case, people have changed and if that person may not be here with us anymore, then I just want to make sure that it gets to the right place. So if you could send it to that general email, that'll make sure they get it to us.
Okay, so not put it to your somebody's attention or anything. Should I mention names in it or something?
If you want to put health insurance webinar or something like that in the subject line, that way they know, but they know that they're expecting that they could get some emails after today for it and they know who to direct them to.
Okay, sounds good. Thank you so much.
Thank you.
Hi.
Hello.
Hi, how are you? Well, thank you for doing this. This is very helpful. Can you speak at all about insurance companies dumping patients? I know it's we want to hear the nitty gritty. I know Blue Cross and Blue Shield of Illinois has been accused of dumping patients. The ones that cost them too much money, they start to deny all the coverages and say that their care is custodial in nature, that anyone, can take care of, the patient. But
I see.
can
I
you
don't have
speak to anything about that?
I don't have any experience with that personally, and I'll let Amy and Renee say if they do. But one thing I can suggest, if you have experience with that and you're feeling like you're not getting the care that your child needs or the care that you need, I would really recommend reaching out to the Illinois Attorney General or the Department of Insurance and submitting a consumer complaint with them, because for the Illinois Attorney General, what they do is they act as kind of like a middleman, a mediator. I've actually used them for myself when I had a health insurance bill that the provider and I couldn't agree on, and they were not willing to work with me on. And I got the Illinois Attorney General office involved, and they had the bill resolved magically in 2 weeks. So I think they're a good resource to kind of, have someone be the middleman to kind of communicate between the health company and yourself if you're having an issue that you're kind of at a standstill. And then the Department of Insurance, they are a good resource of knowing what is, within the legal route, like the law, what's legal for the health insurance companies to be doing. So I think those two resources are where I direct your concern to if you're seeing that.
Okay. Any other the other two ladies have any experience with this or no?
I do not. I haven't heard about that, but I'm going to do some reading up on that.
Wow.
Same
Okay.
here.
Yeah. Oh yeah, it's happening. It's happening. It's happening. Yeah, I don't want to, like you said, disclose too much information, but it is happening to my son.
And you can
And,
always send us an email too if you want to talk more privately about the issue that you're experiencing too.
Yeah. No, but I think it's important for other people to know too that this is happening, with the insurances, and you know what, and they're getting away with it too. But I will definitely, contact the Illinois Attorney General or the Department of Insurance and see what happens there, because every year we appeal, and every year it's the same story. They deny us every year.
Yeah.
I go to the last step I can go to, and every year they deny us. And it's the same answer. And it's affecting my child's quality of life.
Yeah.
And to me, they are helping him get to another place faster, which I don't know, could we call it murder? But that's just me.
Well, I appreciate you sharing your experience so that others can hear it.
Okay. You're welcome.
Okay. We are just at time now. So are there any maybe last minute questions that we can answer? Otherwise, if you haven't any additional questions, we're going to probably recommend that you email them, Amy or Renee.
We had two questions that came in through the question and answer. The first one is at what age does Medicaid approve diapers? I have had one HME state 3 years and one state 5 years of age.
Well, we'll split the difference. Generally, it's 4. So, and we're going to talk more at the next presentation that we do in April. We're going to do the English version of the presentation on April 11th, and then the Spanish version of the presentation on April 12th. So if you want to talk more about Medicaid or learn more about Medicaid, I really recommend you come to that presentation too.
Last question is this one. Is it okay for families to cancel their private insurance for their children in our waiver program since they get Medicaid through the waiver? Some families don't want to pay for private insurance if they can get Medicaid while on the waiver.
Sure. We can't tell you what to do. So I'm going to preface it by that. That's 100% your decision. There's another program that I want to make sure everyone's aware of, which we will talk about during the Medicaid presentation, which is the health insurance premium payment program, which is where the state will pay your health insurance premium if your child has high medical costs. They have a special formula that they use to decide, what makes it cost effective to pay for the insurance. But essentially, they're saying that if they pay even $500 per month for you to keep your private insurance, that's going to be cheaper for them than having to pay all the medical bills if you cancel your private insurance. So if you're concerned about the cost of your private insurance, that's maybe one thing I'd have you look into. The other thing I want to at least let you know about is if for some reason your child no longer qualifies for the waiver, or you lose Medicaid at some point, and you don't have your private insurance, then your only option is going to be going to the marketplace. And because you had the private insurance available to you through your employer, then you may not be eligible for those cost savings where the premium on the marketplace is a little bit cheaper. So just kind of keep that in mind. Obviously, that's different for every situation, every child, based on their eligibility for the waiver and those kinds of things. And if you want to talk more in depth about that, feel free to send us an email. But those are the kind of two things I would say is maybe explore the health insurance premium payment program, and then think about the ability to stay on the waiver, or what you might happen to Medicaid and how that may affect your insurance options if you were to lose that Medicaid coverage. Okay, we're definitely over time now, so I'm going to stop questions there. And I just wanted to thank everyone for coming today and let you know that you're going to get an email with the link for the slides and the related resources and all of the recording and everything. And after we close out of the Zoom, a little survey is going to pop up, and we really want you to complete that survey. Your thoughts are really helpful. This is a new initiative that we're doing. This is the very first training like this that we've done. So your thoughts on how it went and things that you want to see training on in the future are really helpful for us to continue doing these things. And the future webinars are here. Again, that link will have all that information for you. So I've already kind of highlighted them a lot throughout the presentation, but April is going to be Medicaid and May is going to be insurance appeals. And then here is the contact information. So the email is dscc@uic.edu. And then you can also call the DSCC phone number. There's also a contact us button on the website. If you just end up there and click that, it'll get you to the right place. Okay. Well, thank you so much for being here, and thank you to our interpreters and our captioners. Have a good night, everybody.